Hi, my name is Dr. Benn, and I'm one of the cardiac electrophysiologists with the Alabama Cardiovascular Group over here at Grandview. This is Atrial Fibrillation Awareness Month, and I'm here to speak a little bit about atrial fibrillation. Atrial fibrillation is a heart rhythm disease that affects primarily the top part of the heart. It causes the top part of the heart to go really fast, and some of it sometimes passes to the bottom part of the heart as well. It's the most common heart rhythm disease that we see and treat in America. And depending on what you read, anywhere between 8 million to 10 million Americans have atrial fibrillation. Atrial fibrillation acts differently depending on the patient. There are some patients that go into atrial fibrillation and they just cannot tolerate it. They feel bad and they need to go to the hospital immediately. And then there are others that go into atrial fibrillation and they really don't even notice it. And a lot of people actually fall in between, which is where most of my patients say that they probably fall in. They feel bad, they don't feel quite like themselves. Regardless of how atrial fibrillation makes you feel and how severe it is for the individual, we recommend that anybody who suspects that they have atrial fibrillation should let their doctor know. And that's because atrial fibrillation, even if you don't feel it, can cause some significant issues to your health. One of the most concerning things that I tell my patients are that because the top part of the heart is moving really fast, blood essentially doesn't move around too well. And when blood doesn't move, it forms a gel. That gel can then form a clot. And the last thing that we want is for that clot to then travel and cause a stroke. And so to prevent that from happening, we will usually put patients on blood thinners. And that is to prevent the formation of the clot and possibly a stroke. So my recommendation is if you suspect that you have atrial fibrillation, even if you don't feel it, I do recommend that you do let your doctor know, and maybe they may send you to a cardiologist or an electrophysiologist like myself. If you need an appointment, you can call the Alabama Cardiovascular Group at 205-971-7500, and myself or one of my partners will be happy to see you. Thank you again for letting me speak to you.